Chiacchiere di pancia, a cura di Chiara De Benedetti.
Hi everybody, welcome to this very special episode of Chiacchiere di pancia podcast. I'm here with Kirsten. I'm very happy about that. How, Kirsten? How are you?
Hi, I'm fine, Chiara. Nice to be here.
Nice to meet you. We are very close friends. We met in 2018 in New York during professional training about Diastasis, of course. And Kirsten, she's from Switzerland and she's a midwife. She has been a midwife since 2001. So it's a long time you're working in this field. That's great. And she has been teaching pre- and postnatal classes for over 13 years, and she specialized in pelvic floor treatment. So this episode is going to be very interesting. First of all, Kirsten, did I mention everything about you? Did you want to add something about your specialized?
Well, I'm specialized in the treatment of diastasis recti, especially after pregnancy. As diastasis recti, the theme is you are specialized. That's why we know each other. I'm more like woman to treat diastasis than I am a midwife right away, because it's so necessary to help the people. And yeah, that's what I do.
Okay, that sounds great. So first of all, most of the people ask me if it's normal to have a diastasis during pregnancy.
Well, first of all, it's important to say that a separation of the abdominal muscles need to happen to make space for the baby. Every pregnant woman has a diastasis about 4 weeks before the due date. It's absolutely normal. But it's very important to keep the gap as small as possible. And so then you don't have to do so much after pregnancy. So that's like prevention. It's normal that you have a diastasis, but it's good to keep an eye on it so that it's not going to be too big.
Yeah, I see. This is very important. And what do you think about exercising during pregnancy?
The most important mark is that pregnancy is not an illness. And pregnancy means your body is in a very special situation, which is exhausting and demanding on your body. And your body changes a lot of things in a very short time. So your body is really doing a big job. So what you should not do at all is to stop all the exercises just because you're pregnant. But it's necessary to adapt your sports to your situation. As soon as you're pregnant, you should stop workouts which give a lot of pressure to your pelvic floor. It's like, weightlifting, and I mean a lot of weight, like 30, 50 kilos, like high jumping or sports like tennis, which give a lot of pressure on the pelvic floor. You should really stop that. But nearly all other sports you can do it also in pregnancy, as long as you feel good and as long as you have no pain and you don't feel pressure in your pelvic floor. It's all right. Just listen to your body. But it's very important to create the awareness of what you can do and what it's probably too much. It's one of the things I'd like to teach my clients where they come in pregnancy. So I teach them how to use the pelvic floor, which is the floor of your core, how we say, or it's the basement of your body, and then how to use the transverse muscle. That's your inner corset, the muscle which plays a key role in healing a diastasis also, but in pregnancy, it's also the transverse muscle which keeps the baby in position and which gives you a stabilization of your growing body. And it's so important that women keep their transverse strong in pregnancy, because if the transverse is strong, you have less back pain, less compensation issues, and the baby is kept in the right position for giving birth, and you have more strength to push the baby out. You have a quicker birth, and so with a strong transverse, the risk of a C-section is also less, and that's what we want. That's what we aim for.
Mm-hmm.
And what I forgot, the cardio training.
Mm-hmm.
It's also very important in pregnancy to keep your blood pressure healthy and to prepare for the birth. So how would you like to go for a marathon of giving birth without preparing? So stay in your sports, do it, but do it just in the right way, in the good way.
So the key is to listen to your body, and in case of doubt, just go talk to a doctor or a midwife. So you will be, you will know what to do in case of any doubt about it.
Right, somebody who knows about pregnancy, who guides you to show how to do it, where you should stop and where you can go further, right? Mm-hmm.
Okay, that's great. And what happens right after giving birth? How our body try to, we can say, heal? I know you said that it's not a illness, the pregnancy is not an illness, but somehow you have to adjust something. So how our body tries to get back to the previous situation?
Well, I say healing. It is a healing. That's the right word, because if you give birth spontaneously or if you have a C-section, you have to heal. That's probably the right word. So, and the healing takes about at least 6 weeks. And in this time, the body should change into the, let's say, non-pregnant mode again. That means that your core should stop using compensation strategies as it is, or as it was usual in pregnancy. So that's a lot of changing and healing process for the first 6 weeks.
Okay, I see. So 6 weeks is the time that we have to be focused on, and can we do something to help this healing process, to make it easier?
Yeah, well, as a midwife, my focus right after giving birth in the first is all about healing and recovering and getting used to the new situation, like breastfeeding, nursing, and so on. And it's important to know that the more sleep you have, the better you can recover. That means sleeping is a big theme in the first weeks. And I recommend to focus on belly breathing in the first weeks and just light pelvic floor and transverse exercise in a very, very gentle way. Very gentle. I focus not on exercising. I recommend to be aware to use the right muscles in your all-day life, like nursing or sitting down, bending, feeding, and so on. Stand upright, not rounded, connect to the deep system before you lift the baby, and so on. This does not need extra time, but brings the body back to the right system to work. You heal better if you use your body. Don't rest only. And only resting is as less good as doing too much. So you have to find the middle way.
Once again, you have to listen to your body, I guess.
Yeah, it's all about listening to your inner body. That's it.
Course, having the right guidelines, because you have to know how to do it, of course. And do you think that it's better after pregnancy to take care of the pelvic floor before starting to think about the diastasis? Is there any priority that you would recommend?
Well, both is totally connected. So, but after a spontaneous birth, for example, the pelvic floor has issues and the pelvic floor is weak. And then you have to recover your pelvic floor first in the first weeks. And after that, I recommend to train the belly. But it's very, very close together. You know, when you activate your pelvic floor, you activate your belly too, when you do it in the right way. So it's nearly both the same way, but light focus on the pelvic floor, I would say. Yeah, because a lot of women right after pregnancy, have issues with peeing their pants right after birth in the first days, and that's totally normal. And there you need to focus on the pelvic floor, absolutely, but soon to the belly too. So don't forget one; it's always close together. You have to focus on both.
So you think every woman should do something for their pelvic floor and after pregnancy?
Absolutely, absolutely.
That should be something that
And
everybody
not only after pregnancy,
Yeah,
just
yes.
in pregnancy already. And not only women who gave birth, every woman has to care for her pelvic floor. It's so important to have a pelvic floor for us to have to have a good life, because it's not funny to lose urine at all. It's not a good life quality, and that's why I care for the pelvic floor really, really very good.
This is really an important message that you're giving, because it's not so clear to many people that the pelvic floor has a great, I mean, how can I say? It's very important for our daily life. It's not just a matter of pregnancy or whatever. And what do you think about which is the right time to work on the diastasis? Always after giving birth.
Mm-hmm. Well, we know that 60% of mothers still have a diastasis 1 year after pregnancy if they don't do anything. 60%. That's really, really a lot. So it's important to care about it, because a diastasis causes a lot of issues which can be avoided by closing this gap. And I think most of women can start working on closing the diastasis after 6 to 8 weeks after birth, by learning how to connect to the deep system and by core exercises. You start on a very, very low level and raise up your exercises individually. And this is really, really very individual. People who are very sporty before pregnancy, they make a raise up much quicker. And people who don't know how to connect to the deep core, they need much longer. But everybody has to take the time she needs and not do like a special program and follow like every woman does. Just listen to your body again and do what you feel. That's the key, really. And what you feel what's good for you. Not too much, but not too less.
You listen to your body. It's the key. Yes, we know that. But I think it's very important to have an awareness and know what you have to listen, because it's not that easy saying listen to your body. You have to know how to do it, right? So if you have a guide, you can surely listen to your body better.
Yeah, that's it. And that's what I do. I think it's so important to have a professional on your side who shows you where you have to focus on.
Yeah.
What is too much, what is possible, and till what point you can go. And that's my job, I think, to guide the people to feel for themselves what is good for me. I tell people when they come in, I would like you to be the expert of your body on your own, because only you can feel yourself. And I can watch you, but you feel yourself, and that's the most important thing. And that gives a lot of self-consciousness for women to trust themselves and to trust their body and to listen to their body. And that's really important when you're a mother.
Yes, of course.
Your body. Mm-hmm.
Yes, of course. And then you can find the right way, your right way. Everybody has his own way. I mean, it's very personal, right?
Right. It's very, very individual.
Yeah, right. And after that, for example, when people can start their sport activities after pregnancy, do you think there is a right moment when they can start to train again, their training session? It depends on the sports, or it depends on the activity. Which is your advice about that?
Well, as soon as your body is strong enough, you can do everything you want. But that's very individual. It depends on many things. If you have a bigger diastasis, it will take longer. If you already know how to connect to the deep system because you learned it already in pregnancy, you're quicker. I can tell you a general recommendation, but we midwives say that the baby needs 9 months to grow. And you need at least 9 months to come back to sports. That's my recommendation for the first baby. But with the second baby, I give my clients at least 1 year to recover. 1 year.
1 year. Okay,
Yeah.
I guess so. We don't have to be in a hurry. That's it. We just have to do the right things at the right time so that we can recover better and then go back to our normal activities or what we used to do before pregnancy.
Exactly. With the right doses.
Yes, of course. And gradually, I will add that we have to do everything very gradually. We have to have a progression, starting with simple things, and then to move over and do something more difficult, of course, but not in a hurry at all.
Exactly. Mm-hmm.
This is something we are talking about lately a lot, actually, because that's our goal. We would like to do something together and to help people to get back to their usual physical activity. I mean, sport activities, and come back to all the sports that they used to do before pregnancy. So we will work on it, right?
Exactly. And that's because of women ask us a lot. When can I go back jogging? When can I go back to the gym, do my body pump, weightlifting, whatever? That's every week women come and ask us this. And I think it's so important to have a professional on your side who shows you where you have to focus on and which exercise are possible right now in the moment. If you don't dare to do exercise because you're afraid to do something wrong, it's not effective because you do not much enough. But if you want to be really effective and quick and you do too much, it will be counterproductive. So a person who can teach a mom where her limitations are is so helpful, and they need that for their healing process. And yeah, that's why what we both feel what women need, and that's where we need to work on, because there are really less informations for moms for that.
I totally agree. That's what we are trying to do, something about that. We want to, in our professional fields, to try to find the right guidelines to give to the new moms about getting back to getting back to sports. So, I mean, your profession as a midwife, as a professional in diastasis in the treatment of diastasis recti, and my professionality about sports and fitness, I think that would be the right how can I say, the right collaboration.
Right, exactly.
So, Kirsten, if anybody like to get in touch with you, they can find you where? Do you have? I guess you have. I know you have email address. Maybe they can contact you.
Right, exactly. I think you have my email, and you can. I don't know. Would you like me to say that now?
Yeah, you can say it. I will write it down in the.
Okay, it's Kirsten.Zimmerman at Hirslanden. That's Swiss. That's very difficult. .ch.
Oh.
So I work in a clinic, I work in a hospital, and there's a website, and there you can reach me.
Okay, that's great. Thank you very much. Thank you a lot for this chat we have today. It was very interesting, and I hope you will stay with us for other episodes in my podcast. I will be very happy about that.
Yes, of course, sure.
Thank you, and thank you. A big kiss.
Thank you, Cara. It was a pleasure. Thank you. Bye bye.
Bye bye.
Chiacchiere di pancia, a cura di Chiara De Benedetti.